Hi, good afternoon, everyone. Welcome to our Unit 4 discussion here in ST120. It's hard to believe we're already halfway through this quarter. Maybe it doesn't seem like it's flying by for you, but I think it's going pretty quickly. You guys are doing really well. So here are our objectives, for this particular lesson. We're going to talk a lot about the specifics of the sterilizers and the equipment that we're going to be using in sterile processing and demonstrating how to use those effectively and always, applying our midterm and anatomy as we go. So here are your assignments for this week if you haven't looked at them yet. There are a couple extra things here if you haven't noticed. This research paper is worth 90 points, so make sure that you get that in. Things like this research paper in the video you were supposed to upload. Getting zeros for those will drop your grade significantly, like to failing. I've seen it in multiple previous courses where students are like, what can I do to bring my grade up? Well, you need to submit those. I promise you it will bring your grade up. Okay, so I'm going to start putting in zeros for those here today. If you haven't, not for this one, obviously, but for that video, and you'll see how quickly it drops your grade if you didn't put it in. So yes, you can still go back and submit it, even if I've already put in a 0, right? All right, so yes, do your discussion posts. Don't forget, first post is due Wednesday, second is by Sunday. Some of you are still not going back and responding to 2 peers. That drops you several points each time you don't do that. So make sure you're going back and responding. All right, so first let's talk about point of use processing. What does that term mean? And why is it important? Because it relates to best practice. It didn't used to be called point of use processing. So this is kind of a relatively new-ish way of saying this particular process. So why is that important for you? You'll still hear this, the other term, but it's important for you to stay up to date on these things because industry standards do change. And we want to make sure that we're providing the best possible quality care for our patients. So this point of use used to be called flash sterilization. They tried to get away from using this term flash sterilizers or flash sterilization because it was being overused, I guess you could say, or abused in a way, that they were using this particular sterilizer for just sterilizing anything that they wanted to in a way without going through the proper steps of going back through the steam sterilizing longer process, really. So they were using this flash sterilizer when they really shouldn't have been. So they got away from saying that to try to guide them towards just for immediate use if you need it right away. So when we're talking about IUSS or immediate use steam sterilization, we are going to use this sterilization process for things that the surgeon needs right away, has to have it. Maybe you dropped the only pair of scissors that he likes or works, I guess you could say, in surgery, has to have it. There's only one of those in your facility. There isn't a backup for whatever reason. That would be a good reason to use immediate use steam sterilization. Now, if there are multiple other ones wrapped and you could just easily go get one, obviously that's what you should do. You shouldn't abuse the steam sterilizer for those types of things. So there are items that, need to just go back through the entire process. So anytime you're steam sterilizing or any sterilizer, obviously you're going to do it through IFUs because certain items cannot be reprocessed for immediate use. Implants are one of them. We cannot use that as you'd have to go back and get another one from the manufacturer. If you've dropped the only implant, that's a bad day. All right. So if you have a lumen, let's say you're, sterilizing a Fraser suction tip that has a lumen, right? So you still, like you would in decontamination, you're going to brush it and flush it, unless it hadn't even been in patient contact. You would still need fluid in the lumen though. Always follow manufacturer's cycle times because depending on what you put in it changes. how long this load will run. And you're also, this last one is important. You're going to transport it in a way to prevent contamination because these steam sterilizers for immediate use are going to be either, sometimes they put them in a sub-sterile room between two ORs, or maybe in the core in the middle part of the operating room. They're close to the operating rooms. They're not separate from the department because it's for immediate use. So whenever they're done, these items are not wrapped in a specific way. They're usually just in a tray, and you're going to use a something to help carry the tray to the room, but you have to carry in a way that's not going to contaminate the item you just sterilized, right? So be careful with how you transport that. Make sure you have a clear path and that you're not going to have anything touch the inside of that. So you've heard AAMI probably quite a bit in this book already, but it stands for the Association of Advancement of Medical Instrumentation, or AMI. Sometimes they call it AMI. This is the group that sterile processing techs typically go by. Like this is the guiding group that sets a lot of those industry standards that they follow. So always make sure you're following those standards and you're up to date on them. So what about the Joint Commission? You know, that's going to be another one that you have to follow as far as industry standards because the Joint Commission accredits hospitals. They accredit all healthcare facilities. And if your healthcare facility does not pass accreditation, that's not good, okay? I personally wouldn't want to go to a hospital that's not accredited because it means they have not kept up with their best practices either. They've slacked on something. So you want to make sure you're following their guidelines too, so you stay accredited. So they say, in reference to like sterilization, if items aren't cleaned properly, they can't be sterilized properly. So this is going back to point of use processing, right? So you have to clean it first before you can sterilize it. So along with that, they're also wanting you to document anything that you put in there, just in case something comes back. You know, the patient gets an SSI, we can trace it, see what happened. Again, you're going to properly clean and decontaminate prior to sterilization, follow IFUs, and again, lack of instrumentation is not an excuse. You can't just be lazy and you don't want to go through the longer traditional steam sterilizer process. You can't use that as an excuse to use your IUSS. So this little chart here is for the immediate use steam sterilizer. So this is the AAMI minimum recommendations. So it kind of makes it easy that all the temperatures are the same here. They're at 270 degrees Fahrenheit. Your temperatures or your times, excuse me, are going to change based on what is in it, load configuration, and the specific type. So even though they're all IUSSs, it might be, excuse me, a gravity displacement steam sterilizer, a pre-vacuum, or a steam flushed pressure pulse. A lot of them, at least in my area, are pre-vacuum. Now, I would say gravity and pre-vacuum are probably the two most common, and then steam flushed is probably not quite as common. So just be careful that you pay attention to what you have, okay? Things with no lumens do not have to be sterilized as long as something that has a lumen. So notice the difference here. 3 minutes for a no lumen item, let's just like your hemostat or whatever. And then if you had lumens or something even with metal and maybe a mixed material like rubber or plastic is up to 200, or I'm sorry, up to 10 minutes at 270. So pre-vacuum is very similar except the mixed items and lumens. It only goes up to 4 minutes. So gravity displacement may take a little bit longer. Okay. All right, quality control. How do you make sure that that machine, that IUSS steam sterilizer, is working properly, right? So you want to make sure it's effective before you use it. So you're going to check for things like this air removal. It's called the dynamic air removal test. So this is the DART test, is another way of saying that. And a commercial brand name of that is the Bowie-Dick test. So this is making sure it's removing all of that air from the machine as part of that process. You always want to check for record keeping. You're going to be responsible for writing down these things every time you use the steam sterilizer, the IUSS. You have to write what the patient ID was. Sometimes you'll get a sticker, like the patient sticker comes with the chart with the patient. That might be okay to use. This might be in a logbook, or it might just be right next to the machine. The sterilizer ID, what actually was being sterilized, you're gonna want to make sure you have all this so you can track it if need be in your signature. Okay, so let's specifically talk now about high temperature sterilization. So we're going to switch gears away from the immediate use and go over here to high temperature sterilization. These typically take a little bit longer when we're talking about sterilization methods. And these are items that can withstand high heat and steam, so moisture. But this high temperature steam sterilization is very common and super effective. It's one of the most common, so steam sterilization is the most frequently used in most facilities because it's economical. So dry heat is not often used. It's more going to be a moisture high heat. So the reason why it's a sterilizer is because it kills all microbes, including spores. That's the key, including spores. So some advantages, like I just mentioned, it's low cost, it's economical. So that's why a lot of facilities still like to use this. It's just, the cycles aren't that long compared to some of the others that could take hours and hours. It's pretty simple technology and no chemical. We're talking about steam here, so it doesn't have any harmful chemicals on it, which is really nice. So the main components to the steam sterilizer, you have the outer wall, which is called the jacket, that big metal outer part you just saw. There's always a door, right? A door gasket and the chamber drain. But notice here it says the drain is usually near the front or center of the floor. That's sometimes a certification question. They like to ask those types of things. Where is the chamber drain? So front and center, like close or furthest away from where the steam enters, really. And then you have the outside part, which has the gauges and controls that you can see to make sure all the parameters are being met. You can see what's happening. Okay, some other types of steam sterilizers. So we already talked about the IUSS down here. You have the small little tabletop version, which you're probably not going to see in the operating room unless you have a very small, maybe ambulatory center that doesn't run a lot. But usually it's going to be like a doctor's office or maybe even like a tattoo parlor might have something like that. You have gravity air displacement, which the concept here is air is heavier than steam. Okay. So that's how that works. And then dynamic air removal is similar to the gravity, but the vacuum is going to remove the air. Okay. Free vacuum is going to be this is the one you're specifically going to check with the dart to make sure that air removal is happening. And then the steam flush pressure pulse we talked about in the IUSS. Notice the size saturated steam is required for all of these because the steam temperatures increase with pressure. That's what's going to make it effective. So the main phases here of steam sterilization, as this, any of those go through that. First, there's a conditioning phase, an exposure, exhaust, which might, take a little bit of time, and drying. In most steam sterilizers is a drying cycle. So all of these have to go through each step for it to be effective. Now, this is just as important as knowing, times and temperatures, because you could get the right times and temperatures on these steam sterilizers, and you've maybe loaded it improperly, which is going to fail the entire load. So every step of this is important, right? So overloading is going to be one of the main causes that these packs fail or that they do not get sterilized properly. Trying to put as much in there because you don't want to run another one, right? So don't overload it. It won't allow the steam to contact all areas, which will be ineffective. You want to make sure packaging is appropriate for what you're putting in there. Every sterilizer, the steam is going to have a special wrapping versus the ethylene oxide. There's different ways or different packaging that is required. So like I said with this first one, you have to leave some space between to allow the steam to contact all the areas, the surfaces. Place hard goods on the bottom to prevent condensation from dripping. And then packages can't touch the chamber walls. And basins or any like cup has to be on their side to position so it allows drainage to come out. You don't want, because it's steam, it's going to be moisture. It will just pool inside the basin if you don't. It has to drain out. And then any peel pouches are going to be like stood up on their side, not laying flat on top of each other, on their side. So whenever you get a wet pack or a failed load, you're going to have to start troubleshooting. This can be a little bit tricky and daunting at first, I think you could say, but start with the most common options, the most common things that might cause a wet pack or a load to fail. And that's going to be some of these up here, because it's going to go back to what we just talked about, loading the sterilizer properly. So improper loading is going to be the most common cause to a wet pack or a failed pack. Maybe your instrument sets were too heavy. Basins may not have any absorbent material between if they're like two of them together, okay? Wrapped too tightly is not going to allow it to escape. Wrapping items while still moist, make sure everything's dry. Cups are positioned upside down. Again, it didn't pool out. Incorrect filters, maybe, so you can see here like gasket not intact, faulty gauges, broken steam lines. Your first thing is not going to be like, well, steam line's broken, right? You're going to start with the basics, the most likely option here when you're troubleshooting before going and getting maintenance to help you, okay? So that was high temperature. Let's talk about low temperature sterilization. So these are going to be for items that cannot withstand that high heat. It would ruin those items. They're a little bit more sensitive or delicate, maybe even delicate to moisture, not just heat. So 3 options here for low temperature sterilizers. You have the ETO or ethylene oxide sterilizer, effective, but this one is actually pretty toxic if you are not careful. The gas actually is known to be a carcinogen, and you got to be really careful. So this one takes a little bit longer. It's got a longer aeration time, and it is flammable. So there are some, upsides and downsides, right? But it is common. People still use this. H2O2 or hydrogen peroxide gas plasma is the STERRAD machine. That's the commercial brand name for that, the STERRAD, not Steris, STERRAD. So it's a little bit quicker, and they use this for like scopes and stuff. And then the ozone, I would say, is a little bit less common. We don't have one at any of our local facilities, I don't think. Does not require any aeration, but these gases can also be toxic. So these require a little bit more safe handling when we're talking about chemicals. Okay, one last little thing here is biological indicators. You need to memorize these indicators and what they're used for, okay? So remember, a biological indicator is the only true way to assure that that sterilization load has properly put out something that is sterile. It's the only way to guarantee sterility, not the chemical strip indicator that goes in the trays or whatever. Those just show that the conditions were met. So these get run, and it's going to depend on your IFU or AORN guidelines, how often they get put in a load, okay? Sometimes it's every 24 hours. Sometimes it's with every load. So you just got to be sure. But they look like something similar to this. This is the little packet comes in. This one particularly says this is for the STERRAD sterilizer, and it's, what's in this bacteria that's actually in this is Geobacillus stearothermophilus. That's a lot to say. Okay, there will not be a spelling test. All right. So Geobacillus stearothermophilus actually is in a couple. So you've got your STERRAD, or VHP, and ozone as well, and your steam sterilizer actually as well. And then ethylene oxide is also a little different, Bacillus atrophius. So they're actually like bacterial bacillus spores in this little vial, because spores are the hardest to kill. So you want to make sure you're killing the spores to render it sterile. Okay, so hopefully that will help you out. All right, so if you have any questions, please feel free to reach out to me. You guys are doing a really good job at reaching out, and you guys are plugging along. So keep up the good work. Have a great day.